Good afternoon, everyone. Thank you for joining us today. It's a pleasure to be with you, and I appreciate all that the graduate students do for NC State. I do appreciate your patience and your flexibility as we work through ongoing challenges with the global pandemic that is COVID-19. I know some of you have started to return to campus in limited capacities for research, and while others continue to work remotely. I want to say up front that I know that this is a very challenging time. There's a lot of uncertainty about this virus. There's a lot of uncertainty about the conditions under which we're expecting to operate. And I want to acknowledge up front that you have a lot of questions, and we're going to try to get to as many of those today as we can. But please make sure that you read all of the information available to you on the Protecting the Pack web portal that's on our homepage. We keep it updated almost daily, and every decision and every thing that we're working on is reflected in that website. The policies, the guidelines, and modifications to campus that we're putting in place are meant to mitigate risk and help us safely to reactivate campus operations. And they're also meant to help you make decisions about your own personal health and safety. And we're committed to doing all that we can to ensure that the NC State community stays healthy and safe, and that we do everything we can to support one another's health and safety. I'll go over quickly some of the measures that have already been put in place. Again, these are on our website, so please make sure that you visit it. We have required face coverings or face masks on campus, and of course now they've been mandated statewide by Governor Cooper by his executive order. We've also made it clear that we needed to open campus early in an attempt to try to complete the semester before the beginning of Thanksgiving, and that way we have an extended winter break, and that gives our students an extended period of time to be away from campus and prohibits or at least limits the amount of students that are coming and going from campus. We're in the process of evaluating classroom spaces and determining which courses will be online. We're near the conclusion of that time as we have to get all the classes ready for registration. And so there's a deadline rapidly approaching there. While the list hasn't been finalized yet, you'll hear more about that as we finish with the forum today. We shared information on our preliminary plans for reactivating campus a little over a week ago, and these will continue to be updated. So please know that not everything is final at this point, but we're getting very close to making final plans. A number of you in submitting your questions pointed to some of the challenges that we're facing as a country and as a campus around diversity and inclusion. And I want you to know that we've heard your concerns. We've had a number of conversations with key campus leaders, student leaders that is, about diversity issues on NC State's campus. We're committed to doing everything we can to support our campus and make this a welcoming and diverse community. And we're proud of some of the steps that we've taken, but know that we have a lot of work to do going forward. And while I know that there have been a number of questions about that, the focus of this town hall, and I want to be respectful of everyone's time, is really on planning around reopening, again, related to COVID-19. I have many members of the Chancellor's Cabinet with me today. I'm grateful for their time and their leadership, as well as other leaders from across campus that are here to respond to your questions. In a few minutes, you'll hear from Lexi Malico, the president of the Graduate Student Association, and you'll also hear from Dean Peter Harries. So let me begin by introducing Peter Harries, the Dean of the Graduate School.
Thank you, Chancellor Woodson. And I just want to acknowledge and convey my welcome to you all and thanks of you joining us today. As the Chancellor said, this has been an incredibly complex and fluid situation, and that has made it really hard to constantly make decisions and to plan as the ground under us has been changing at a tremendous rate. And I really appreciate the patience that you've had as we try to deal with this. As the Chancellor mentioned, we're still trying to work out what the class schedule is actually going to be. And we hope to have the ability for you to know what your courses look like and what you're going to be able to do in the near future. And certainly the graduate component at NC State is an incredibly important element of our educational environment in terms of not only teaching and the important role that teaching assistants plays, but also in the research mission of the institution. Certainly, those efforts hinge on the role that graduate students play, and certainly the research restart has involved numerous graduate students who have made it back to campus and are beginning to get that research effort back under control. I also want to echo what the Chancellor said about the importance of equality, diversity, and inclusion. And the graduate school is committed to that. And we have put substantial resources towards trying to build a greater diverse and inclusive environment for graduate students. But as the Chancellor said, we still have a long way to go and want to engage with students and student groups to try to do as much as we can to push that effort forward. At this point, I would like to introduce President of the GSA, Lexi Malico, who is also a PhD student in chemistry. Lexi.
Thank you so much, Dr. Harries. I want to begin by thanking Chancellor Woodson for extending an invitation for me to participate in today's event. It's incredibly important to recognize the need for graduate student voices in these evolving conversations, particularly as they relate to our roles as students, teachers, and researchers. I hope that graduate student voices will continue to be sought out with higher frequency over the coming weeks and months as we look forward to this academic year. I've spoken to a lot of graduate students over the past week, and I want to both acknowledge and validate the anger, anxiety, and fear that so many of us are feeling. As graduate students, we often feel like the expendable arm of the university, and we recognize that right now we are more valuable and more vulnerable than ever in terms of our health and safety, as well as our financial and job security. We're concerned about face-to-face instruction in the fall, as opposed to focusing on enhancing online methods, especially with rising case numbers in Wake County. In response to these concerns, Student Senate President Coleman Simpson and I wrote a statement that was released today detailing these concerns and outlining our requests to the university to create meaningful and measurable action. It's our hope that the university will commit to addressing these critical concerns relating to the current crisis, as well as more systemic and long-term issues. I want to acknowledge that this statement was written in no small part by the graduate student body who gave significant input, so I'd like to thank all of you for your participation and contributions to this. This town hall is just one step in a series of many steps in terms of addressing these problems. The Graduate Student Association is here to support and amplify student concerns, as well as hold the administration accountable. We are committed to representing and advocating for each of you, especially now, and we urge you to reach out to us via email if you have any questions, comments, or concerns. And I will turn the floor back over.
Thanks, Lexi. Maggie, do you want to start?
I would love to.
I know you would.
Our first question, we've had several inquiries about masks. So will students and faculty always have to wear a face covering on campus?
Yeah, and before I get to that response, let me acknowledge Lexi's comments and make it very clear to you, Lexi, and all the graduate students that, first and foremost, NC State is a research intensive, doctoral intensive university. We have, as you know, Lexi is a PhD student in chemistry. We have a top 20 PhD grading program in the country. We produce a lot of talent, and that's a high priority for the university. So I just want to commit to you that Dean Harries and I and all the leaders across campus are going to take your concerns seriously and make sure that we're doing everything we can to work collaboratively with the graduate students to address your concerns. So I didn't want to ignore your comment at all, because I think it's hugely important, and frankly, it's very important to NC State. We can't be successful without our graduate program, and we need you all to be successful. So let's get to the questions. So Maggie started off by throwing the face mask question my way. And so let me say from the beginning that, as I mentioned when we started, the governor has announced an executive order requiring face masks to be worn at all times when you're out in public in the state of North Carolina. Prior to the governor's announcement, we had announced that face coverings or face masks are required on campus in all university buildings, and including classrooms, and even in outdoor spaces where you can't be assured of appropriate physical distancing. We've asked all of our students and faculty and staff to keep a face mask with them at all times as they walk across campus and run into that long lost friend of theirs and they need to have an up close and personal conversation. They can whip out their Wolfpack face mask and do it with the protection that they need to stay healthy and to protect the people that they're visiting with. So yes, face coverings will be required for all faculty, staff, and students. There are exceptions to that, those exceptions being if you're in your residence hall room or if you're in your private office and you're able to adequately socially distance in an enclosed space, then by all means, take a breath. But for the most part, when you're on campus and in public spaces, you'll need to have your face coverings on. Next question, Maggie.
Our next
At the end
question
of the day,
is,
this is going to be fun.
the next question is, how will you enforce the requirement that everyone on campus wear a face covering?
Well, I can tell you what we're not going to do. We're not going to send the police after you. This is really, our goal is to make face coverings and face masks a community standard. Really an expectation, although it is a requirement, we want everyone to feel a commitment to keeping themselves and their colleagues at NC State healthy and safe. And the best way to do that is to wear face covering or face mask. Having said that, we will put in place, we have put in place policies that will allow us to enforce, if you will, face coverings. And let me turn to Lisa Zapata, Dr. Lisa Zapata, the Director, Vice Chancellor for Division of Academic and Student Affairs, to talk about the student side.
Thank you, Chancellor Woodson. So as Chancellor said, we do expect that all members of our Wolfpack community, all of our students, faculty, and staff will want to do their part to keep themselves healthy as well as our entire community. So for students, we are in the process of creating a rule that will require masks as part of our community standards and expectations. But we really are taking an educational approach, and we'll be appealing to students to uphold our community standards and to do what is best and what is healthiest for our PAC. If they do refuse to do so, they could be subject to disciplinary action under the Code of Student Conduct. So students are expected to wear masks in the classroom. If a student is not wearing a mask, the faculty member or the instructor can ask the student to put a mask on. If the student refuses to do so, then the instructor can ask the student to leave the classroom. The faculty member can also choose to submit an incident report through the Office of Student Conduct, and we're here to assist with that process. But again, the hope is we are going to be able to create an environment where everyone will want to protect the PAC and wear face coverings. Finally, there will be an opportunity for students, faculty, and staff to request special considerations regarding face coverings, and that could involve accessibility or other circumstances. And we're working on that process right now and look forward to having that ready by the beginning of the semester.
The only thing that I would add, and thank you, Lisa, is that what we don't want to have happen is this to become a contentious issue between individuals on campus. If you're, let's say you're a graduate student working in a lab and you've got a colleague that refuses to wear a face mask, then you have a mechanism to report that up through supervisors, up through the department, etc. The last thing we want people to do is to take it into their own hands and to confront people on campus. Again, it's all about lifting up the community and making sure that we take this on as a community standard. So thank you. And Maggie, let me turn back to you.
We had several questions around campus testing, what's available on campus, and whether students and employees will be tested when they return.
Well, I call frequently on Dr. Julie Casani, the director of our Student Health Center and director of health at NC State, a phenomenal academic health clinician, but also an expert in the general area of public health and epidemiology. She brings tremendous expertise to NC State, and we're thrilled to have you here, Julie. So it's your turn.
Good afternoon, everybody, and thank you, Chancellor. So as you probably know, a viral test or an antigen test can tell you if you have an active infection or if you're an asymptomatic or even a pre-symptomatic carrier. So we at Student Health, we've been doing and will continue to do viral tests on symptomatic students who come into Student Health Services for their care. But we also conduct viral tests as part of our contact tracing program. And that program includes student, faculty, and staff. So I get a lot of questions. In fact, I've gotten about 40 emails today specifically about this, about what are we doing with widespread testing on campus for people who don't show symptoms. And there are a lot of models for testing, including pooled samples, surveillance clusters, specific risk pool testing, and we continue to look at all of these possibilities and all of these options. But right now, as of 4/17 on Monday afternoon, we're not thinking about that we're going to be implementing widespread testing on campus for people who don't show symptoms. And the reason for this is that we've modeled and looked at a very aggressive and active testing center. And the best that we can do, which is the best that a lot of testing centers can do, is about 300 to 400 tests per day. Now that's less than 1% of the campus population. And at that rate, that's way below the level for results to be meaningful, effective, or even realistic. And so currently, that's what we're looking at. But there are other ways to keep campus safe, and we've talked about a lot of them already, and you're going to hear more. So we encourage people to follow the risk reduction guidelines, wear a mask, stay physically distanced, self-report if you're having symptoms, and cooperate with our contact tracing program so that we can actually identify people who might be in close contact, who might have been exposed, and stop any potential spread. But as everybody has said, it's all about personal responsibility, and it's really important for those kinds of actions to keep our campus community safe. I wear a mask to protect you. I wear a mask to protect my coworkers and my family. Wear masks, wash your hands often, and especially don't go to class or to work if you have any symptoms. And we're here at Student Health to try to get you taken care of.
Thank you. Maggie?
Our next question is, can you explain how the contact tracing program will work?
No, but Dr. Kasani can.
Thank you. So the contact tracing program was started this summer here, and I'm really proud of it. It's worked really, really well. We have had a couple of people who have enrolled in our program, and we're really relying on people to self-identify, not only students, but faculty and staff, to self-identify that they either have been diagnosed with COVID-19 with a test or have been told that they have COVID-19 even in the absence of a test. So once you have that happen to you, we're asking that you fill out the confidential online forms, and you can get them on the Protecting the PAC website, as well as the Student Health website, or you can call Student Health if you don't have access or can't find them, and we will get you enrolled. What happens then is that our contact tracers, all of whom are healthcare providers here and in Student Health, will contact you, and we will go back to the day you started with symptoms and go even 2 days before that, because that is a period of time where people may be asymptomatic or pre-symptomatic carriers. We then reach out to those contacts, and so it's important to be as accurate and as close as you could be to that list. We don't identify you because we want to protect your medical confidentiality. We contact those people. We offer guidance and resources. If they're employees, we direct them to the HR webpage. We also give them lots of information. And then we give our recommendation for 14 days of self-quarantine. During that period of time of self-quarantine, we follow up every day with a questionnaire so that we monitor symptoms. And if symptoms do develop, we can get people into care. And that's our goal. We do this not only for NC State people, but we coordinate with Wake County Health Department for the non-NC State contacts that are identified. So that's it in a nutshell. And again, it's worked pretty well. We've had a couple of people who have gone through the contact tracing program. It's been pretty successful.
Maggie?
What are the plans in case we have an outbreak when classes start again?
Yeah, this is the big challenge for all organizations, frankly. And I'm going to go back to Dr. Kasani because this is her world, and she's been living in it for a long time. Not that you're old or anything, just experienced. It's wisdom.
Wisdom. So if we do identify that there is an outbreak or an increased number of cases on campus, and we look at a lot of metrics as to what that might mean. So we look not only in the classroom, hopefully we'll be looking as well in some of the residence halls, some of the other subpopulations that work very closely together. It might be a research lab. And if we find that there's a problem, we are trying to develop a stepwise approach to those thresholds so that we don't go immediately to the most significant of restrictions, and that we take step by step to try to prevent more spread of the disease and more risk to others. Of course, this all goes into the basket of what is required of us by the government, by the state government and Wake County Health Department, and also what's required of us and recommended for us by the systems office.
Thank you. Maggie?
Our next question is, in terms of campus safety, how will students receive health services?
Well, so Julie, this is a really big day for you. So Dr. Kasani.
So it's student health. We're open. We have been open all summer, and we'll be open again as always in the fall. So we have instituted not only our in-place, face-to-face care, but also over the summer we instituted telehealth. It's been very successful. The students love it. The providers like it, and so we will definitely continue it throughout the fall. The difference in the fall will be that those of you who have accessed student health already this summer know that students will have to call in to make an appointment. There won't be any online appointments, and we will not be accepting any walk-ins. The reason for this is because we want to see people in a timely fashion. We want to get them in to be seen, but we also want to be sure that people who have symptoms of COVID-19 are not mixing in with people who are well and here for their continued care or who have other health problems. So we're trying to control the infection even here within student health where people might be sick. We think that this process may actually give us more appointments, especially with the added telehealth. And so I know that you might get nervous and hear, oh, I have to call in for an appointment, I may not get one, but we think that we're gonna be able to provide additional services, if not the same level of services. So please bear with us with that. We also have the ability to shift services and perhaps lighten the load on some of our services in order to provide surge capacity for the primary care providers. So we've been nimble in this. We did things in the spring. We learned a lot over the spring and the summer, and hopefully we can carry that through the fall to get you the health care that you need, especially for the graduate students, because we know that there's a high utilization rate in graduate students, and you rely on us, and we know that.
Thank you. Maggie.
Many students are dealing with extra stress right now due to the isolation and worrying about friends and family. What additional counseling and mental health resources will the university provide to students in the upcoming semester?
So I'm going to give Dr. Kasani a break, and let me start by acknowledging, as I said at the outset of this, this is a very difficult time for a lot of us and all our families, our students, and our faculty and staff, and we know that. And I've been really impressed with the ability of the Counseling Center at NC State to respond to the needs of our students. Even last spring when we were forced to move entirely online. So let me turn to Dr. Zapata, who leads the Division of Academic and Student Affairs that has a counseling center within Student Affairs. So Lisa.
Thank you, Chancellor. We do know, as Chancellor said, that this has been an extremely difficult time over the last few months. And students can always access our counseling resources and support by calling the Counseling Center. And as the Chancellor said, we did pivot in the spring and we moved to telehealth, and we are going to continue providing telehealth this fall for our individual and group counseling, as well as responding to crises. And we're also going to have some specialized programming, some additional resources this fall. So we're going to have specific groups and programming focused on COVID-19 related concerns, such as isolation, grief, and loss. And then we're also going to be providing programming focused on racial trauma, the impact of oppression, and support for international students as we come back in August. In addition, the Counseling Center and Prevention Services are currently offering drop-in spaces right now for students. And that's focused on topics such as building community and support for women of color, recovery, and overall adjustment and belonging. So in addition to the resources that you always have available through the Counseling Center, through Prevention Services, I do want to remind everyone of the wonderful resources that we have through the community centers, through the Office of Institutional Equity and Diversity, all the work that the colleges are doing, and then also the work of the Office of International Services. So we are here to support you and to promote student success.
Thanks, Lisa. Maggie?
Our next question is, are you expecting recreational facilities in the gym to reopen? What rules and regulations will be in place to ensure everyone's safety?
Well, we are expecting them to be open. And Lisa, why don't you tell us how?
Absolutely. Thank you, Chancellor. So if the governor lifts the restrictions for gyms and fitness centers as part of the reopening plan, then we anticipate reopening Carmichael on Monday, July 20th. And when you come back to the facilities, things are going to look a little bit different as we've had to reorganize and repurpose space in order to be able to maintain physical distancing. Some of our spaces will remain closed when we reopen in July. That includes the basketball courts, climbing wall, equipment checkout, indoor track, racquetball courts, and showers. But that's just because we cannot maintain the distance required in those spaces. But we're really going to focus on our fitness centers. We're really excited about this. And in order to make sure that we don't overcrowd the space, we're going to ask and encourage our students and our members to reserve space in advance. That'll be for the fitness centers as well as for swim lap lanes. Once the maximum occupancy has been reached in those levels, then we won't be able to take any more registrations or have folks enter the space during that time period. So it looks like we'll have approximately 175 people will be able to access the fitness centers each hour. And that's roughly about 50% of capacity currently. However, once the Wellness and Recreation Center opens up in October, which we're super excited about, then we expect to be able to double the occupancy in our fitness spaces and return to pre-coronavirus levels. Our fitness centers will be closed for cleaning and disinfecting between each reservation time. And then to go back to everyone's favorite topic of face coverings, we will ask that people wear face coverings as you're moving about in Carmichael. But currently, during your actual workout, face coverings will be strongly encouraged, but they will not be required. And then finally, let me give you a couple of quick activity updates. We're super excited to start our in-person group fitness classes in the fall. Intramural sports will be limited to virtual offerings and also any events, in-person events where you can maintain that 6 feet of distance. Many of our club sports do plan to operate if they can follow the distancing requirements and also follow any restrictions provided by their national governing bodies. So we are really excited and eager to open back up and provide our campus opportunities to be active and healthy and fit.
Thank you. Maggie?
We're moving on to questions about academics. How will tuition be affected if all the courses a graduate student takes are online?
Let me turn to Dr. Hunt, who has been leading the academic reactivation and the calendar conversation. So, Lewis, do you want to take that one on?
Sure, I'd be happy.
We're excited to.
Yep, glad to. Welcome and thanks for being here this afternoon. Graduate student tuition, it hasn't changed. It's based on the student's program. So if you're in an online program, you're charged the distance ed tuition and fees. If you're on an on-campus program, you're charged the on-campus tuition and fees. We haven't made any changes there.
Well, and to put a finer point on that, that actually is a system requirement, a Board of Governors requirement. And so it's true for all 16 universities within the UNC system. Next question, Maggie.
Can face-to-face classes be optional for students going forward until COVID-19 subsides completely?
Dr. Hunt.
Sure. At this point, the departments, as the chancellor mentioned in his opening remarks, they're still working on their schedules. They have until Wednesday this week to make the final decisions and give them to us. By the end of the week, you should see in your schedule those reflected. So I can't guarantee that every course will be available online. Quite a few of them will be. The provost asked for all faculty to have a plan to support students if they can't do face-to-face instruction. We're going to reopen the registration system on July 13th for new students and July 20th for continuing students. So at that point, if you're looking for more online courses or more face-to-face courses, you'd be able to go in and make adjustments to your schedule.
Thank you.
So our next question, if a graduate student opts to attend class online this fall, can they later choose to attend those same classes in person?
I think that's a dean question. Peter? You're muted.
Thank you, Chancellor. In terms of this, again, it would very much depend on ultimately what the delivery modes are for individual courses. So going back to what Dr. Hunt just mentioned, that's still being decided for some courses. So if a course is being offered in a face-to-face as well as online delivery mode, there may be the opportunity to later switch how a student is receiving the content. So if conditions improve and people start off online, they may be able to move to face-to-face. But ultimately, this is really going to depend on the classroom capacity. I mean, one of the struggles in this whole exercise that Dr. Hunt's team has been struggling with is how to get all the classes in and how much room will be allowed for each course, because physical distancing will have to be maintained. So if there's capacity, I believe students will be able to switch to a face-to-face mode. But if that course is already filled with students in that mode, then there may be some issues there.
So it's a case-by-case basis.
Exactly.
Maggie?
So we have one last question about online courses. If students know they struggle with online instruction, what resources should they seek out?
Peter, do you want to take a shot at this? And Lewis may have a view, and Dwayne Larrick is on the line as well. Let me start.
Sure, I'll start, and they can certainly add anything that they may have. So I think, this has been given quite a bit of thought, and, it is impressive how quickly a team of folks led by Dr. Catherine Stewart in the Provost's office developed resources both for instructors and for students faced with online instruction who may not have had as much experience as others in that format. First and foremost, though, if you're struggling with issues, please get in touch with your instructors. I mean, instructors have office hours for a reason, and also the ability to be reached in many other ways, and they can often provide great support into insight into the issues that you may be facing. Another element that has been developed is a resource called Keep Learning. And there's also a Keep Teaching resource for TAs. And that's housed by the Division of Academic and Student Affairs. And it's a website that provides numerous pointers, strategies, and resources that students can use to enhance their experience in the virtual mode and, of course, their learning.
I think one of the things that, the only point I would like to make is that one of the values for us to have campus open and active and operational is that students, even in online settings, assuming they have access to campus, can take advantage of our new facilities in the DHL library. And I see Greg Rasky on the line. It'll be a more interactive experience, at least to the extent that we can make it so with the social distancing that's required. And one of the things we learned last spring when all the students were scattered about is that, they lost the community and they lost the ability to utilize the resources of the library and the resources of the university in general. And so I think it's important for us, to the extent that we're able to keep those resources available to our students. Louis or Lisa or Dwayne, anything you want to add to this?
Chancellor, the only thing I would add is that fall is going to be very different from spring. So spring, we had to pivot very quickly. This is if we have courses online this fall, we've done so very deliberately, and they're well planned out and should have a lot more support around them.
Good point. Maggie, next question.
Many graduate students' time to degree timelines have been interrupted due to an inability to engage in research during this time. Are there any plans for extended funding and deadlines due to interruptions outside of their control?
Peter, do you want to take a stab at that? And Balad may have a view of it as well as a research vice chancellor.
Yeah, I think, obviously, given the constraints, the typical constraints of the Graduate Student Support Plan, or GSSP, there are natural concerns about how disruptions like this may impact the ability for students to retain their funding. And let me just say, the university is committed to supporting its graduate students in this research role. I mean, we've talked about how vitally important that is as an institution. And we realize that people's trajectories have been negatively impacted by this. Although research restart has happened and there are numerous grad students re-engaged with their research, there also are some who have not been able to return to campus. So the decision that has been made, and this is based on a conversation between the graduate school and the provost's office, is to readily extend those GSSP benefits for students whose academic progress and completion has been delayed or otherwise disrupted by COVID-19. And the way that we are going to deal with that is basically by having students use the exception process, which is well established. Please talk to your DGP about that. They should know. And then what we will do is have students enroll for only 2 credits, as long as they're at 72, to continue their progress towards completion. The admittedly more complicated part of this is the stipend piece. But so far, we've seen exceptional flexibility and engagement through numerous departments to keep their students going. And in terms of for teaching and research assistants, there will be no change in the Graduate Student Support Plan benefits as long as the enrollment requirements are met. So there will be a requirement to enroll, but the tuition support and the health insurance support will remain for students who have been delayed.
Dwayne, anything you want to add to that?
I think Peter has covered it very well. We're working constantly on our plan to try to make sure that we're, we know that the biggest factor in completion for graduate students that are at the end of their academic career would be losing funding. And so we're committed to make sure that we keep our students in place and get them to graduate.
Well, in the university, one of the earliest reactivation strategies for NC State was to reactivate research to the extent that we could. And that was a critical step that we took, recognizing that there are a couple of things. I mean, recognizing number one, there are limited timelines on research funding associated with projects, and knowing that graduate students have limited timelines to complete their work so they can complete their dissertation. So that's, that was one of the early reactivation strategies for NC State. And I have to say, it's helped us a lot to understand how to reactivate campus safely. Amy Orders is on the call as our Director of Emergency Management Operations, and she and Vlad Volk, the Vice Chancellor for Research and Innovation, have been very involved in that part. You guys want to say anything about reactivation and research, or has it all been said?
Well, if I can add to this, Chancellor, we have now allowed anybody who has requested to be on campus in the research space to be on campus, obviously following fairly strict PPE rules and so on. But so the only ones that are excluded right now are human subjects research projects because of the interactions with outside world. But so if anybody hasn't been included, you should probably contact your advisor, and all the funded students are currently allowed on campus.
Okay, thank you. Amy, did you want to add anything?
I'll extend to Dr. Volk's statement. We also have face coverings available for students who have returned to campus as part of Campus Restart and research this summer, and continue to roll out more supply. So as more individuals come back for our research purposes, we're ready to have you here.
Great. Thank you. Maggie, your turn again.
So the next question we had may have already been answered, but I will ask it for the sake of asking. How will NC State ensure that laboratory work is safe for graduate students?
Lon, do you feel like we've covered that, or you and Amy may want to tag team that?
Well, I can just add that there is really already a well-developed plan and practices in place for re-engaging research and laboratory work. We have given a lot of thoughts to how it should be done safely, and how current and future conditions will impact safe research densities and other aspects of it. And we are constantly monitoring laboratories and their safety, and creating mechanisms for students, faculty, and staff to report any concerns that they may have. So,
Amy, anything else? Well, and I'll remind you all, in case you don't recall this, but NC State is also a big school in agricultural sciences, and some of the early critical work that had to get started in the spring was the planting of crops associated with research projects. And so we've had in place for quite some time strategies for faculty to seek and students to seek exemptions so that they could do their work and do it in a way that protects their health and safety. So Maggie, next question.
Why will the orientation for new students be provided virtually despite the fall 2020 semester being on campus?
Peter, do you want to, that may be something you and Lisa want, but I think it's primarily in grad school.
Yeah, thank you, Chancellor. Under normal conditions, the graduate school runs 2 separate orientation sessions. One for more research-oriented degrees, including the PhD students and some of the master's students, and one for non-thesis programs. Each of these sessions serves more than 1,000 new students. And so, given the limitations that are in place of a maximum of 100 students per classroom, as well as the requirements for physical distancing in these settings, this was impossible to do face-to-face. We have done a lot, and we're working on enhancing the online component of this. And one of the big features that we had in the past between both sessions was an information fair. And we're currently obtaining videos from the various offices across campus that took part in that, so that at least we can introduce graduate students to a broad range of different opportunities and offices that can help them that are located across campus. But ultimately, we made the decision that it was just frankly impossible and unsafe to do.
Aggie?
Many graduate students are at a lower risk of contracting COVID-19 than their primary investigators, which could lead to them taking additional risks to keep research going. How will the university make sure they are safe and treated fairly?
Well, Peter, I think you please start that, but I think it goes back to some of the comments that Dr. Volk and Dr. Orders mentioned about the reactivation of research. We put in place very strict guidelines about the functioning of labs and the way individuals have to take personal responsibility in labs, with opportunities to report then when that's not occurring. But let me, having said that, let me turn to you, Peter, to see.
Yeah, I just want to broaden that too, because I know there's some concerns among graduate students that because of that reduced risk also, that they may have greater requirements to serve as teaching assistants and so on in the face-to-face mode. And the approach that the graduate school has promoted with the colleges and with the directors of grad programs is that these graduate assistants should be offered the same level of flexibility and accommodation as faculty. So that's really what our mantra has been to departments and colleges. And we've certainly also asked where there are cases where that's not happening, that we be made aware of that as the grad school. And to date, we have not had a single example of that. I'm not saying that there may not be some out there that we don't know about, but we have not been informed of those. And I will say that the colleges and departments have been incredibly flexible in retaining employment for graduate students through the spring and the summer. And we expect that to continue in the fall. One of the problems, if you will, associated with grad assistants, especially with teaching assistants, is that they're not subject to using a time clock. So they're basically hired as half-time, what's called FTE, which basically is equivalent to 20 hours of work a week. And so they will have to be carefully monitoring their own work situations and advocate for fairness. There's a variety of ways in which that could be done, starting with reaching out to the directors of graduate programs and department heads, but also extending to the associate deans for academics and the graduate school if people feel uncomfortable reporting that at the director level. I mean, at the department level, and we're certainly very cognizant of the imbalance in power that graduate students also feel. Finally, the ombuds, the Office for Institution Equity and Diversity, are always ready to help, and students can also submit anonymous reports via the website that's been created for student complaints.
Okay, thank you.
We have a number of questions about international graduate students and visas. First, what is the university doing to help those who need visas?
Yeah. Well, let me start, and Dwayne, I want you to be prepared because I'm going to turn to you. This is a very challenging time for our international graduate students. Many students around the world that are trying to get to NC State are struggling to get visas because often American consulates are closed because of COVID-19. And so let me start by acknowledging that it's a challenge. Some of our students that are already here and enrolled at NC State and need to get their visas renewed, we're also working hard to make sure that we help those students. So let me turn to Dwayne and have him respond to it, and then we'll fill in any blanks with the Dean of the Graduate School as well, Peter.
Thank you, Chancellor. As you've said, there really are two groups of students here. The first are our new international students who reside outside of the United States and are looking to come. And then second, those students who are here and need to extend their visas because of COVID-related delays. For the new international students, I would say that many of our programs, especially those in our College of Engineering, have created expanded asynchronous course schedules for the fall semester that you can register for during fall semester, and those courses will transfer to your on-campus program when you're able to come here, hopefully in the spring semester. You should be working with your director of graduate programs to schedule an appropriate number of courses for you to be taking online, and it's an advantage that I would certainly encourage you to consider. For continuing students who need to extend their visas, your program likely can be extended, provided you still meet eligibility requirements in general. Those requirements basically are, first and foremost, that you submit a request prior to the end of your I-20 date. That is very critical in this process. It has to be prior to the end of your I-20 end date. You have to be making progress towards your degree. You have to be able to show proof of funding. NC State can certainly confirm that the delay was due to compelling academic reasons, most likely due to the COVID-19 situation. So I strongly recommend that you contact the Office of International Services with specific questions. And the Office of International Services is also planning several reopening town halls for our international students, and they will be sending out notices to all of you associated with those town halls.
Thank you. I think the most important point to make, in addition to the details of going through the process, is how much we value our international students. And we desperately want to continue to bring you to NC State. You mean so much to our campus and do so much for our university. So we're excited to try to solve some of these problems with you. And Maggie, I think the next question we may have already answered but you go forward and then I'll let you know if that's true, because I don't know what you're going to say.
So the next question we had, I do believe, has been answered. It is, if a student does secure a visa before August 10th, but is unable to arrive on campus before their program begins, will the university allow them to start their program online until they get here?
And of course, that's our goal. And we're working hard to make that happen.
So the next question. What support is NC State providing to international students at this time with sudden executive orders regarding immigration and visa changes, travel bans, concerns about DACA, and embassy closures?
Well, this is admittedly a very difficult time and a lot of uncertainty around international students, et cetera. I've already told you all how we feel about our international students, and it's a critical component to NC State, and frankly, it's a critical component to the U.S. In our view. The Office of International Students has been very engaged in this area of supporting our students. Obviously, we just recently had a very good decision, at least in our view, from the Supreme Court with regard to DACA, and that's a good outcome for many of our students that fall under the DACA rules. But as we look at travel bans and we look on restrictions for travel because of the pandemic, every country is different. And I'd say that you need to work through our Office of International Students and Scholars to make sure that you've got all of the support that you need to find your way to NC State and be supported. As a university, we're going to continue to advocate, as we have, for continue to bring extraordinary, talented students to NC State and to the U.S. Because we know it's important, not only for our university, but for our country.
Okay, I think we can squeeze in one or two more questions.
Let's do it.
The next question is, will the library be reopening? And if so, what will be different?
No, we're not going to open the library. I mean, that's just too much. No, I'm kidding. Everybody right. Greg, where are you?
My notes tell me we are going to open the library, Chancellor. So no, we're excited to open the library. We're looking forward to it. July 20th, the Hill Library is slated to open, and shortly thereafter, the Hunt Library and the branches will open up as well. We're excited to welcome students back for the fall. This is true for everybody, but the library is every place on campus, but the libraries without students, they just don't have the energy, the heart, the feel. And so we really are looking forward to having you all back in there. Things will be different for your safety. We won't have 24-hour overnight hours in the fall, so we can clean, really to do deep cleaning for the facilities and to protect students and staff. The density of the seating will be spread out more to allow for social distancing. Spaces that typically have groups conglomerating in them, we won't have that anymore. We'll just have single use or small group use in those spaces. Group study rooms that are typically used by 3 or 4 people will be reserved for single use for people who want to have their own sort of environment when they come in. to the library. We will have technology lending, but we won't lend things like headphones that might be a transmission source. Instead, we'll just give you your own disposable headphones to use. Certain things like print textbooks, we'll just scan them for you instead of trading them back in and out. But we're looking forward to having you back. We will open the new Academic Success Center in the Hill Library in August as well, which is exciting, one-stop shop for academic success and data science support, including services for graduate students.
Thanks, Greg.
Thank you.
We're excited to get life back in our libraries. They really are the heart of NC State's campus. Okay, next. Come on, Maggie.
Last question. How will information about COVID incidence rates on campus be shared with the campus community?
Yeah, let me start with Brad Bolander, our Director of Media and Marketing and Chief Spokesman for the university. And Brad, you start, and then, I think Dr. Kasani may have a view on this subject as well. So you start, Brad, and we'll.
Sure. Yeah. Thank you, Chancellor. So the main way that students, faculty, and staff are going to be notified about potentially coming in contact with a COVID-19 person is through the contact tracing program that Dr. Kasani talked about earlier. It's very robust and excellent program. If you've come in contact with someone that's been identified through that program, you will be reached directly and provided some next steps. In cases, if we have them where we can't identify everyone who may have come in contact with a recently diagnosed person, a large gathering of people, for example, we will do broader campus updates, and we'll do all campus updates if we think there's a health or safety risk to the campus community. So really, from our perspective, we're going to work with Dr. Kasani, we're going to work with Dr. Orders, we're going to err on the side of caution and make sure we're putting out whatever communications are necessary to keep our students in our campus safe.
Julie, I'm afraid I'm going to have to cut you off. I know that's hard for you, but we've come to the end of the witching hour. Is there anything else, Maggie, before I sign off?
No, just any closing remarks you have.
Yeah, I want to thank all of you for not only everything you do for NC State, but for bringing critical issues to our attention. We started that conversation with Lexi talking about some of the critical issues that graduate students face. And this is a university with 36,000 students. Almost 10,000 of those are graduate students. As I said from the beginning, we're one of the top 20 or top 25 largest doctoral programs in the country. We take a lot of pride in graduate education at NC State, and we take a lot of pride in what graduate students bring to our campus and our community. So we're going to do everything we can to help you succeed. And thank you all for joining us today.